in biology and in psychology, frankly, it really often pays to think about the extremes first and then work our way towards more typical circumstances. And with that said, addiction, unfortunately, is very common nowadays. I just heard a statistic, in fact, that there is an 80% increase in alcohol use disorder among women in the last 30 years. Again, I want to be very clear. I'm not somebody that is completely against alcohol for adults, provided they're not alcoholics. Turns out 2 drinks a week, probably fine health-wise. 0 would be better. If we're honest, 0 is better than any alcohol, but 2 drinks a week is probably fine. Past 2 drinks, you start running into problems. And yet many, many people out there, male and female alike, suffer from alcohol use disorder, also called alcoholism. The same is also true for things like methamphetamine or cocaine or other types of substance addictions. And the same is also true for a lot of behavioral or what are sometimes called process addictions, things like sex addiction or video game addiction or any type of behavior that frankly is leveraging the dopamine system, but that engages this progressive narrowing of the things that bring someone pleasure such that nothing else is really salient. Nothing else is really pulling them in the way that their video games or sex or pornography or alcohol, pick your substance or, behavior that you see out there or hopefully not, but that you might suffer from an addiction to. So what's happening in addiction? Well, addiction involves dopamine, among other things, often, the opioid system, etc. But if we were to think about what's the stimulus in an addiction and what's the peak in dopamine, and then what happens after that peak, it all becomes very clear as to why addiction happens and why it's so pernicious. So for instance, let's take cocaine. Cocaine causes dramatic increases in dopamine very, very fast. So if somebody craves cocaine, what are they craving? They're craving that dopamine peak. They're craving the increased level of alertness. They're craving a number of things associated with the feeling of being under the influence of the drug. But the stimulus for it simply becomes that line of cocaine. Or in the case of crack, that crack rock that they're going to smoke. And God forbid they're mainlining it, they're shooting into a vein. What happens is they snort, smoke, or inject cocaine, and dopamine levels almost immediately go up to a very high peak. Okay, so the time gap between the stimulus and the dopamine is very, very short. So short, in fact, that there's really no other contingencies in between that the mesocortical system has to learn. In fact, what does the system, quote unquote, learn? It learns cocaine equals massive amounts of dopamine equals feeling euphoric and energetic, etc. And in doing that, it reinforces the whole circuit so that short, we can even say hyper short contingency is really what the system wants. So much so that longer contingencies of, say, putting in the hard work of, generating a fitness program or a professional program for yourself or a education program, which takes not just many days, but many weeks and years. Well, none of that is going to lead to peaks in dopamine that are as high as the peak in dopamine associated with cocaine. So that tells us something critical. It is both the duration between desire and effect. And when I say effect, I mean the rewarding properties of dopamine that are experienced. That's important. So very short gaps teach the system to expect and want short gaps. Makes it very hard to pursue things that take longer. So when we say it's the short, or in this case, hyper short distance or time between the stimulus and the dopamine, what we're really talking about, if we were to plot this out on a board or on a piece of paper, is the steepness of the rise of that peak. It's very, very steep. The peak in dopamine is coming up very fast after the desire.